Have you ever thought, why can't I find help? Or why do I feel stuck even though I'm participating in treatment? It's not just you. It's the system, and access to therapy is expensive. Medications can only do so much, and most providers aren't trained in working with borderline personality disorder, BPD. But there are ways to move forward and manage it, and that's what we're going to talk about today. And the first part that I want to talk about is improving access to care. Now, you can't find a therapist, I understand, in your area, and that it's very challenging, and it's very disheartening, and you're trying, or if you do find one, the wait lists are endless. I completely understand. Some people aren't even taking new clients. And the cost of DBT, mentalization-based therapy, schema therapy, that makes it really expensive, and it feels really out of reach. And you start to wonder, am I ever going to get real help? It feels unfair. And treatment, even though it's proven to work, can sometimes be the hardest to access. And I completely understand. So I want to tell you what you can do about it. First, look for therapists that are trained in DBT and that may do schema-based work. Now that can really be helpful because integrating these skills, even though they're not in full programs, can be helpful. Workbooks can also be really helpful. With workbooks, you just need a greater degree of motivation. You just have to stick with it as best you can. And one of the challenges with workbooks, and I have several that I have written myself, which is that people try to digest it all so quickly. Don't. Take your time with it. It's just like the therapy process. Go in and out, work on it, and then try to do your best, and then incorporate some of those skills or that knowledge, that insight that you learn, and then go forward. That's the key. Now, in your area, if you want to work with a mental health provider, look for community clinics. They are great. University training centers, also very affordable. Or group telehealth options can also be helpful. And they may even offer sliding scales, which can be really helpful. Also, if you have a medical provider, ask about what's called good psychiatric management. This is GPM. Many general providers can use it effectively for managing BPD. Remember, access doesn't define your worth. Skill building can begin anywhere, and access is critical as to how you can access that. Don't forget, workbooks are helpful. I have an online course that is also helpful. There are other people who have online courses. There are resources out there, or YouTube, for example, can be a great way, low cost, even free, that can help a lot of people getting information. That's what this channel is all about. Now, I also want to talk about going beyond symptom remission, but also how to get there. And that's the tricky part. So this is our second part, talking about symptom remission. And you've worked hard in therapy, and it's been hard to manage those crises, I understand, but emotions still feel intense and unpredictable. Even after progress, right? You might still feel that emptiness, that shame, that abandonment, that rejection sensitivity, and even a fear of being left out of nowhere. This goes back to that abandonment. And you might be thinking, I'm not falling apart anymore, but I still don't feel at peace. What is that component of peace? And daily stressors still may hit you like emotional earthquakes. One comment, one rejection, and you're right back in survival mode. Have you had that? That one activating statement, that one activating event, and then you're thrown back into the fury of a BPD episode. Now, that can happen, and that's also pretty normal. It's also part of the process. So recognize, even if you lose it, even if you have a BPD-driven episode, that doesn't mean that you're all the way back to zero. What it means is that you've had an incident. You got to take ownership of it. Oh, and I know that's tough. Sometimes that's really tough, particularly if the people in your life tend not to be very forgiving, and that can be really hard, but you have to take ownership. We got to apologize, recognize that the things that we did, and then move on. And you have to move on. If other people can't, that's their problem. You've taken ownership. You've accepted the accountability, and then you're ready to move on. Now, let's talk about what you can do, though, in order to reduce symptom intensity. First, you got to track your patterns, not just moments. We're looking at patterns. What are those things? Notice when those emotions really kick up. Could it be a time of day? Could it be a situation? A relationship context? Could it be a particular person? A family member, maybe? Maybe, right? Awareness reduces reactivity. Don't forget that. It's important. Also, label those emotions clearly. Insight builds control. Instead of saying, I feel awful, I want you to name it. Hurt, guilt, jealousy, fear. The more precise you can be about naming it, identifying it, that gives you a sense of control. Absolutely. Ground yourself before you act. I'm telling you, don't just let your BPD and family in the head determine what you're going to do and how you're going to act and react. Use brief, practiced tools. Again, my workbooks, my other material on my website, I have a bunch of free worksheets for you too. All kinds of stuff that's out there. These are practice tools that you can use. Some of the greatest tools that you can use is deep breathing, sensory reset. That's kind of grounding yourself, right? Grabbing something like here, I got the lid to my camera, just kind of feeling it, like how rough it is. That's grounding. I'm getting centered in the moment, and it's so important to do that. Also, take short walks. Take out the AirPods. I know, it's hard, right? We all want to jam, but you got to take out the AirPods and just allow your brain to kind of process what you're going through, where you are in the moment. I think too many of us stay out of the moment, but the moment is the only thing we can control, and that is critical. Break that impulsive loop that sends you down that road, that spiral of losing control. Challenge your story, particularly if your story and the people around you are always saying, well, that's your BPD. Everybody's allowed to get upset. Now, BPD episode is definitely much more than that. It tends to be much more destructive. But individuals with BPD, they're also allowed to have emotional reactions. Now, we want to temper those, right? We want to lessen those. And this goes to your story, right? And think about what else could be true. When you look at your life with a curious lens, you're able to analyze what is going on in a much more objective manner, as opposed to feeling like you have to defend yourself, right? Like you're right there. You got to defend yourself, okay? And when you look at it through that curious lens, this disrupts the all or nothing split, and it prevents those negative, extreme interpretations that amplify your distress. Remember, what we think impacts the rest of our body, but that means we have to control what we think. I know it's tough. I totally get it. And working to shift from reacting to responding is also a critical step as well. Pause before you send that text. Oh man, do I say that all the time? Pause before you send the text. Remember, texting is a receiver-based messaging system. It is not a sender-based, meaning when you send a text, it is up to that person's interpretation and the mood that they're in and how they're seeing you and how they're seeing what you wrote and how they're seeing everything else. So recognize texting isn't the best communication means. I know it's easy. I know. I like texting. I enjoy it. But I like to add emojis, which help clarify a possible mood. I like to put the fox in there. You don't even have to ask why. And then the thumbs up. Hey, right? To show, hey, everything's cool. All right. I send that a lot because I want to add that sense of clarity. That also gives me a degree of control over the communication. So people don't misinterpret it. I want to decrease the probability of someone misinterpreting it. And if everybody's judging you because of your BPD, or they're assuming that all your reactions are BPD based, then adding those emojis can really add a lot of clarity. Rebuild your identity through your action. Each time that you make a healthy choice, even a small one, I don't care what it is, could be super, super tiny, right? You're teaching your brain that you can regulate and recover. And that's critical. You have to show the evidence to yourself and on a regular basis. I know it's tough. I know it's tough, but it's unlearning those maladaptive beliefs, behaviors, and patterns, and embracing and learning the adaptive ones. Engage in relational repair. When conflict happens, practice going back, circling back, rather than disappearing. Don't just do the disappearing act because you're embarrassed or you're hurt or you feel like, well, this, that, or the other thing. Don't do that. Repair builds trust and stabilizes that mood over time for you. Integrate structure into your life. Routine is critical. A lot of individuals with BPD don't like routine or structure because sometimes they feel like it's boring or they feel like that there isn't, this sort of intensity that they want in life, but that's validating that maladaptive beliefs, behaviors, and patterns that you have in your brain. We got to suck that out of your brain because I want you to create routines that anchor you. This could be consistent sleep, so important. Eating healthy meals. Look, I like junk food as well. As you know, if you've been on the channel before, you know I love those dark chocolate covered almonds. They are delicious. But I can't eat them every day and all the time. I might want to, but I can't. You got to have something green on your plate. I remember that in elementary school. They taught us, got to have something green on your plate every time. Okay, is it green M&Ms? Not all the time. Put some green ones on there, kind of treat yourself. But I want you to also exercise mindfulness or even journaling. Now, I have a BPD journal that a lot of people have found helpful. So if you're using it, that's great. Or there's a link in the description as to where you can get it because journaling is helpful too, getting it out and looking at what's going on in your life on a regular routine basis. That provides you with that sense of structure. Consistency reduces the emotional spikes that get equated to BPD. And we don't want to do that. Now, let's say that your primary care provider is your main source of treatment. And I understand that. But you could be frustrated when your main provider isn't a BPD specialist. So they don't really understand what's going on. And it can feel like you're getting real therapy, just medications or check-ins. So it feels a little disparate, right? It feels like it's not really matching up. It's like, feel like I'm getting some therapy because I'm going into my provider and they're talking to me a little bit, but then they're giving me medications. But then it goes to what are those expectations about the medication? Is the medication going to make everything just go away? And it doesn't. And if you've seen my other videos, you know that I talk about core content and surface content. We're going to talk a little more about that when we talk about medication limitations in a minute. But other times, even with your primary care physician, is that you may feel invisible, like your complexity isn't being seen. And that's in large part because they don't understand. They haven't really been trained on BPD, and they're often going about misinformation or stigma, that's what they're really responding to. Now, I'm not blaming, medical providers or anything like that, but it's true. But it's hard to be trained on every medical and mental health issue. So sometimes we got to give them a little bit of grace, right? And if you feel like it's not a good fit, then sometimes we got to look for someone else who can help us with our mental health issue. And you can also ask your provider about good psychiatric management, GPM, or they can learn it, which would be great. Now, GPM is an evidence-based approach that is designed for non-specialists. This can be really, really helpful. But your general practitioner, they have so many things going on, it's really hard for them to focus on that. That doesn't mean they don't care about you. Don't let your BPD and family in the head talk you out of getting the help that you have access to. Make the most of the access that you can get access to. How's that? Bring structure to your own care. Track goals, symptoms, and what helps each week. Don't just identify the negatives. I think we have a tendency to over-pathologize a lot of symptoms and functioning. We don't want to do that because that's what empowers BPD and family in the head. Like with my clients, I'm always looking for what did they do in an adaptive context? What did they do to help themselves? What did they do to grow? What did they do to build their skills? And I'll tell you, I'm a huge cheerleader for them when they do it. Absolutely. And I want to be in their brain telling them, yes, keep doing those positive things because that's so important. View your primary care, right? Access as a base camp. This is a place to stay steady while you build skills and seek deeper therapy. Don't expect, and I want to discourage you from having too high expectations about medication and what it can do. Limitations are coming up. Advocate for your needs, collaborate, don't just comply. It's okay to ask your medical provider questions. Now, if they won't answer them, maybe it's time for another medical provider. And that can be really, really important because they could be frustrated too, because they're in the field to help people. They are. And I know I've worked with many people with BPD who feel like that their medical providers don't care, don't know what they're doing, this, that. I totally get it. But this, it's a challenging field for them to get into, and I do have empathy and grace for them. I really do, because I think it's difficult to treat everybody. And that doesn't mean it's okay to discount people either. So we're going to have this wide dimension of providers that are helpful, and some aren't going to be helpful at all. But we got to also look at medication. So the limits of medication. Now, the odds are pretty good if you've been diagnosed with BPD or you have BPD traits, that you've tried medication after medication and still feel that emotional instability. You still feel all these issues. Side effects can leave you feeling flat, foggy, or even disconnected. You're unsure which medication helps or if any do at all. You fear that you will be stuck dealing with this stuff forever, that you will be stuck with this BPD, and that BPD and Family in the Head will be in control forever. Let me tell you what you can do. First, ask your provider to review your medications every 6 months. That's the new standard. Focused medication on specific symptoms. That's what we want to do, like sleep or anxiety. These are what I call surface content, right? Not the personality itself, not the global issue. What medication can do, it help to treat that surface stuff. It doesn't treat abandonment, rejection, emptiness. It doesn't treat those things. It can't. It's not designed for that. It just can't do it. Now, track how you feel weekly. I want you to be an active participant in your treatment. What improves? What doesn't? And guide those reviews. What's helping? What's not helping? And this isn't just for your medical provider. It can be for your mental health provider. It can also be just for you to learn about you and how you operate. We want to pair medications with therapy because that has the highest efficacy, and that research has been around for 50 years. So we know medication plus therapy. But when we talk about personality disorders, therapy tends to be more efficacious, more impactful than medication, because medication is going to treat those surface contexts. We have to get to the core content, and that's where the therapy is. Medication should be seen as a supportive additive, not as a curative one. And that's really important. And people ask me all the time, and I'm going to put it right here. Can you cure personality disorders? Well, let me tell you. Can you cure the flu? No. Can you cure the common cold? No. There's a lot of medical conditions that cannot be cured. Now, if you're like, oh, he's evading the question. No, I'm not. I'm just illustrating beforehand to say, no, we can't cure them. But how about this? There are many instances and people that I've worked with and treated who came into me and they were in that BPD episode flurry of issues and problems and disruptions in their relationships and how they saw themselves. And we worked together and they were able to build management strategies and control so they can determine the course of their life and not BPD and Family in the Head. I have a number of clients that I'm working with right now and have in the past. If you were to meet with them and they said, oh yeah, I was diagnosed with BPD, but I don't have any current traits or symptoms. That's called remission. And you wouldn't even know that they were diagnosed with BPD. Now, does that mean that there aren't going to be resurgences of symptoms? Absolutely. There aren't going to be mornings where you wake up and that little voice is somehow popped back in your head. You don't know why, but you're going to use those strategies and push it back out. That's the management and control aspect. It's just like anything else. We have to live that healthy lifestyle, managing those maladaptive beliefs, behaviors, and patterns, and working to control it, to go forward in a positive way. And you absolutely positively can do it. That's why I keep making these videos. That's why I want you to put those comments in the comment section to help other people, or read them yourself to get some feelings of support, because that's what this community is all about. How can we support each other and look at the genuine reality of this disorder, borderline personality disorder, and the management and control strategies that you can utilize in order to move beyond it. So I hope you found this helpful. Check out some of my other videos, and please click the thumbs up or the share. That really helps the channel. I'd really appreciate it. Thanks a lot, and have a good day. Bye-bye.